All right, so what I have to show you here is a Sidelying hip series work, and I'm going to be doing it on Tower of a Reformer here. So there are a couple key things that I'll point out as I'm going to go through this, but technique is going to be very important, that we're maximizing our glute activation and not the front of the hip muscles, the TFL in particular. They can sometimes happen when people do Sidelying hip work. So we're going to have a spring attached on the lowest setting here, and we're going to come into a Sidelying position here with the knees bent. Okay, so the first thing, the spring's going to kind of flex the hips. So the first thing we're going to have the client do is they're going to push that leg long and straight, and you want to make sure that their hips are stacked. And you do not want the hip to rotate up towards the ceiling here. If anything, you want the top part of the pelvis to rotate towards the ground. So we're going to allow the knee to flex, okay, putting the glute stretched out, and now we're going to contract and straighten the glute. As they straighten, you want to cue them to think going very long with this here, okay? And if you notice that I am coming up into a little bit of abduction as I'm going through this. Okay, so as we come through here one more time, we're going to swing up a little bit into abduction, and straightening out. So it's maximizing glute max and need here, and no work on the front extensors. And then from here, you can also have them rotate their toes down towards the table, so their big toe is going to touch the table, and then slide up. Then it's going to come down and slide up. Okay, so they're going to hold this straight position and come up. All right, so from here, we're really working that glute max, glute med in combination, trying to minimize any anterior hip musculature that may be involved in this one. All right, so those are two exercises that can be blended together as modifications of some other Sidelying series exercises to work with those people specifically who want to improve their glute max and glute med while minimizing anterior hip musculature. All right.